First step is to brush your teeth. Brush the biting surfaces of your teeth, ensuring that you reach the very last tooth. You can use a little bit more force when you are brushing the biting surfaces. Always ensure that you reach the very last tooth. Then proceed to brush the biting surfaces of the upper teeth, also reaching all the way to the back, advancing forward and then moving on to the other side. Always use toothpaste containing fluoride as it can help to prevent tooth decay. Next, brush the outer surfaces of your teeth. Position the toothbrush at a 45-degree angle, pushing the bristles into your gums, and then doing a jiggling forward-backward motion, about 5 times each. Advance forward towards the front of the teeth, always ensuring that you have a 45-degree angle between the toothbrush bristles and your gums. This might feel a little bit uncomfortable, but you will get used to it in time. The discomfort also means that you are brushing correctly. Notice that my gums are not bleeding when I'm brushing this way, as this is quite a gentle technique. But if your gums do bleed, it will actually indicate that your gums are unhealthy and that they are currently inflamed, and that's due to a bacteria being trapped underneath together with residual food debris. So by brushing with this technique over a few days or maybe up to a week or so, you should actually see that the bleeding will stop. And this also applies to flossing and using a little interdental brush, which I will teach you later on. You will also experience some bleeding, but it will stop after your gums become more healthy. So when you are using this technique, always ensure a 45-degree angle and always reach to the very last tooth. Remember that you're actually jiggling the toothbrush and that you're not making very big movements such that you're brushing on your gum line, because that can actually brush away your gums, would be at a lower level, and that can cause tooth sensitivity. In addition, you might also brush away part of your teeth, which is very soft right below the gum line, and that can cause a little cavity, which will also lead to increased sensitivity. So brush along from one side to the other, always maintaining a 45-degree angle. This will take approximately 5 minutes for the entire duration of brushing. The process of brushing your teeth will take about 5 minutes. Always take note of the two forces, which is 1, you pushing the bristles of your toothbrush into your gums, and 2, the side-to-side motion. Now, you need to brush the inner surfaces of your teeth. Again, reach to the very back and push the bristles at a 45-degree into your gums and do a forward and backward jiggling motion. Always brush twice a day at the minimum, and you also need to floss or use the interdental brush or both. Do brush before going to bed at night and after taking your breakfast in the morning. If you do not brush your teeth daily, food debris and bacteria, which is essentially plaque, will start to accumulate, and you will be at a very high risk of developing gum disease in the future. Brush one tooth at a time for the front teeth, and then when you're progressing back to the back teeth, you can then brush 2 teeth at a time again at a 45-degree angle. Even when you're brushing the front teeth, you must still maintain a 45-degree angle. Then progress all the way to the back, reaching to the very last tooth, and then jiggling back and forth while pushing the bristles in. Now you need to brush the inner surfaces of your upper teeth, and this can be quite challenging. However, do practice and you will get better at it. Very important that you use a soft toothbrush and not a medium or a hard one, because first it will be very uncomfortable for you to brush under your gums with this method, and secondly, the toothbrush will actually wear away your gums, and that will also lead to the sensitivity that I mentioned earlier. So for the front teeth, as you can see, I'm still doing a 45-degree angle, but the toothbrush is angled differently this way, and I'm cleaning one tooth at a time. This normally applies to the front 6 teeth, whereby I'm unable to clean 2 at a time. However, when I move on to the back teeth, again, I change the angulation of the brush, but still maintaining a 45-degree angle and brushing 2 teeth at a time, progressing backwards. After toothbrushing, the next step is to clean between your teeth, and this is very important. You cannot skip this step. It's just as important as toothbrushing. Using a floss, twirl it around your fingers. Gently ease it into the interdental space between your teeth. Do not jam it in. Then go all the way to the bottom into the gums and make a C shape, and then pull the floss out. It's very important that you do this method whereby you make a C shape with the tooth. So I've done it on the other tooth, and now I'm hugging the other tooth and making a C shape and then slowly easing it out. So you must clean both teeth, so you go into the same space twice. See, first I'm choosing the tooth in front, I'm doing a C shape, and you can see that it's all the way into the gums, and then I'm slowly easing it out, and this will remove the food. I'll clean the floss, I'll go back into the same gap, the same space, and I'll slowly ease the floss in, make a C shape, go very deep all the way into the gums as such, and then I'll slowly ease the floss out. It's the same thing when you are cleaning your front teeth. Doing the C shape, you can really see that it's really into the gums, and that's important. You want to clean under the gums. And then I'm going back to the same gap, doing a C shape to the other tooth, and then removing the floss. Here are more examples. So I'm doing a C shape into the gums, choosing the front tooth first, then removing the floss. Clean the floss, go back in, same gap, but this time the other tooth, making a C shape and removing the food debris. It's also the same concept for the back teeth, the molars. It's slightly more challenging, but with practice you'll be able to get the hang of it as well. Going back the same space, now leaning towards the back molar, the back tooth, and then slowly easing the floss out. The second way is to use an interdental brush. So you just have to ease it into your gap between your teeth, pushing it into the gums and leaning against one tooth first, then going back the same gap and leaning against the other tooth. So do the same thing for the tongue side, the inside of your mouth, pulling it in and out in the direction of the brush. Lean against one tooth, then lean against the other tooth, brushing in and out.